Everyone's familiar with the background already, so I won't labour the point, but we know there's been this emerging lineage coming up through the Middle East, and it's affected along the way Saudi Arabia, Iran, Armenia, and Turkey, and is knocking on the doors of the FMD free zone in Turkish Thrace. This is a summary of the vaccine matching data done at the World Reference Laboratory at Pirbright, and overall you can see the matching is poor across the board. This is the R value here, and this isn't all the vaccine matching that's been done, but it gives you an impression of the available vaccines generally have been quite a poor match, which is why several companies have rapidly produced a monovalent vaccine. But we know that, and the other thing to say is that we know that these vaccine matching results can be very variable. So it's sometimes difficult to interpret. But the one that was kind of interesting is with the A Saudi 95, because of the ones here, it looks like it's towards the right end of being appropriately, well, more appropriate than perhaps the ones down here anyway, appropriately matched, but still relatively poor. And also this vaccines are in use in countries that have had disease. So it was interesting, I thought, to look at some field outbreaks of this. So a bit of background about Saudi Arabia. Saudi has some of the largest dairy farms in the world. The farms there are, some of the farms are immense. They're like cities of cows. And they have had, on some of these farms, there have been outbreaks of lineage, the new genotype 8 genotype, have occurred on some of these farms despite regular vaccination. So the objective of this presentation is to just give a very brief description of some of these outbreaks on 4 large-scale farms, and to give a bit of a flavour of how the vaccine performed that contained the Saudi 95 strain. And I'm going to show you some individual animal data, and also at the end a little bit of serological data from an unaffected farm that was using the same vaccination schedules. But analysis is ongoing, so there's more to do with the data. So 4 large-scale farms, all Holstein dairy cows that we're very familiar with in Europe and North America. And these farms are in this sort of area, sort of south of Riyadh. And the farms use the same vaccination schedules and often the same batches, but they are distinct epidemiological units. And this is what they do for vaccination. So they all use an aqueous-based NSP purified 6PD50 vaccine, and it had 2 A strains in it. So A around 05 and A Saudi 95, the one that we're kind of interested in, of how it's performing. And this is the vaccination schedule. So these animals are very, very heavily vaccinated for foot and mouth disease. And they are vaccinated on average at the age of 4 months, 5 months, 6 months, and 7 months, and then every 105 days, which is synchronized with the herd level vaccination. So these are the epidemic curves for the 4 farms. And I think the thing to point out here really is the fact that some of these outbreaks were quite short. So on the 3rd farm, these are just numbered in order of sort of when they became affected. And this farm here, the outbreak was quite relatively small and just lasted for 21 days between the index and the last case. But some of the outbreaks went on for quite a long period of time, up to sort of 3 to 4 months. And the sort of, from what you can see from the epidemic curves and also from what the farm reported, is that there were distinct phases of the outbreaks that occurred, sort of 2 distinct phases. In 2 of the farms here, so farm number 3 and farm number 2, so you look at farm 2 here, there's a big upsurge of cases here, and then on farm 3 there's a short sort of break, and then there's a couple of cases. And this is just because this is how the outbreak spreads. It just reaches new susceptible animals as it's going on. So that's nothing particularly sort of surprising. But what's a bit more interesting is these 2 outbreaks here, because the intervals were quite long. So this interval here was 27 days, and there were no cases, and then all of a sudden there was a case. On this farm, it was 62 days. So it's kind of interesting as to, well, what was happening in that intervening period. Was the virus still there, or was it a new introduction? So I'm not going to pretend to understand all the sort of background to how these things are calculated, but this is some work done from the molecular epi team at the Pirbright Institute. And what we saw is that on the farm that had a 27-day interval, we think that the chances are the virus was just continued to be present. So the farm either didn't report the cases, or it was subclinical and persisted. On the other farm, there's a question mark over actually whether it may be a new introduction, possibly. But again, we need more sequences to identify kind of if that was the case or not. So just a few more observations on these outbreaks. So on farm number 1 here, these are all the houses with the cattle, and this just affected adults. It did not affect young stock. And despite the fact that the young stock were really close by. So what the farm did is they isolated the clinical cases, first of all kind of in the sort of associated unit, and then they isolated the affected animals here. And yet you did not get any cases among the young stock. And usually in the field, we see the young stock are the ones that tend to have the disease between the ages of 6 and 18 months. But they did not show any disease, despite high risk of exposure. And all the farm did was they used internal sort of biosecurity protocols to try and limit the spread, of course. But they put up a windbreak, like some hay bales to try and sort of stop any potential spread. And it seemed to work in this case. On another farm, these are all young stock. These are all young animals of similar-ish age group, and the outbreak was very contained. Just these groups here. It did not spread. Just 5 meters away, you had more susceptible animals of a very similar age, so you would expect a similar immune status because the herds are sort of closed, with the same vaccination schedules. Yet it was very contained, and all they did was they moved the infected animals to this location here. So in terms of the overall incidence, now, because some of these farms are immense in size, like this, on farm number 4, there were 23,200 roughly adult dairy cows. So these are cows that are sort of lactating at above 2 years of age, just to sort of clarify what that means. And young stock is everything else from 0 to first calving, essentially. So the overall incidence was relatively low, but of course, because these farms are so big, you can't assume that every animal was exposed, because the farms are so big. So what I did is I actually just looked at what was the incidence in the affected groups, because I know that the affected groups were exposed, but I don't know about the unaffected groups. And so when I look at the incidence risk on the different farms, it varied a little bit, but on average, using robust standard errors to adjust for the intergroup correlation, the incidence among the young stock was 18.7%, or around 20%, but in adults was 8%. And this is just to show that, I won't labor these pictures here, but they did practice reactive vaccination on these farms when the outbreaks occurred. And due to variable vaccine availability and uncertainty over the strain that was causing the outbreak, they used a combination of vaccines. So they had some of the usual vaccine, the Aftervax Pure, but they also had some other vaccine which did not contain the Saudi 95 strain. So this, I think, could be quite interesting to compare the incidence in these groups, but I haven't done that yet because I haven't received the data long enough to do that amount of work. But in terms of the time since vaccination, when the outbreak started, that ranged from 15 to 65 days. So just the last couple of slides. So we were interested in knowing what the vaccination response was, what were the titers on the farms. But of course, we couldn't do that on the farms that were affected because they'd been exposed. But we found another farm which had not had any clinical disease reported for many, many years. In fact, the farm had not reported any clinical FMD since before any of the animals on the farm had been born. So we did an age-stratified sampling approach to see what the titers were, stratified by age. And the samples came to the Purbright Institute, and we tested them for NSP antibodies and also neutralizing antibodies to the homologous and the field strain. So this was the NSP assessment. So bear in mind, this farm had reported no clinical disease. Yet, among the 1 to 2 year age group, the percentage of animals that were NSP positive was nearly 80%. So it really surprised. It was surprising for the farm. It was surprising for us because the farm, the farm is very well managed, and I don't think they would admit to. They were interested to know what the titers were. It wasn't in their interest to deceive us. But I think that this is quite surprising. I mean, it kind of implies that maybe there's been some in the group that were sampled, that there was some subclinical infection that had been going on. And with that sort of incidence, or seroprevalence, I should say, then the chances are that there has been sort of subclinical transmission that's been going on this farm. But just to say, I don't think that was due to the serotype A G-VII. The titers, the neutralizing antibody titers, were not different for serotype A when you compared the NSP positive and the NSP negative animals. So I think that this is probably due to another serotype. And actually, there had been outbreaks of serotype O, India 2001, that had been going on in Saudi as well. So maybe there was some subclinical infection going on there. So these are the neutralizing antibodies. So these are the neutralizing titers here, and these are the homologous vaccine strains, so AR-05 and ASAO-95, and this is the field strain from the farm, or from one of the affected farms. And you see these titers here. I mean, I think that you'd be pretty happy with these sorts of titers. You can see that the titers, these are the different age categories here. So you can see that the animals quite rapidly get good titers and they maintain them. But for the field strain, again, these titers are around 2.5. You'd be pretty happy with that. But when we look at protective cutoffs, that's the cutoff that's reported based on challenge studies done at the Purbright Institute. This is around 2. They're well above that, which I think's kind of a bit surprising. So this is a different farm, of course. This is a farm that may, for some reason, there could be something different. Maybe they did the vaccination better than the farms that got disease. But I think it's actually likely to be very similar because they use the same vaccines, they use the same schedules, often the same batches. So I don't really see why this farm would be any different. So I think actually that despite probable satisfactory heterologous titers on those farms, you still saw an incidence of 8% in adults and around 20% in young stock. So it makes me question how valid the 2.0 cutoff that's from this study here is. And I think when it comes to correlates of protection, we know from other diseases, like in human studies, that correlates of protection can vary in different populations and also in different age groups. Like the correlation of protection for a child can be different to an adult. But this is something that's not, we focus a lot on the results of challenge studies with correlates of protection, but we don't actually have evidence of field-based correlates of protection. And this is an important area that is really understudied for FMD. And I believe personally, in my opinion, is it deserves further thought and work. So just to summarize, so this analysis gives an idea of the level of disease one can expect in the field with this vaccine match using a 6PD50 vaccine. The infection can, in these outbreaks, it can persist for quite a long period of time on these epi units. And also there may be some evidence that there's some subclinical infection going on. Also, I think it was an interesting observation that in some outbreaks, using simple isolation and quarantine procedures and biosecurity, it is possible to contain these outbreaks. It's not inevitable that everything just gets disease. But we need to learn more from the field about how best to do this. And also, like I say, I think there's maybe some question marks over the antibody titers and whether they correlate with protection in this particular setting. And just a few acknowledgements with the Saudi Ministry of Agriculture and, of course, the farm and all the other people that have helped with this work. Thank you.
Thank you for this very nice presentation. Questions? Yes, 1, 2. David.
Thank you. Very nice presentation, Nick. I have a question. Maybe you showed it, but I missed it. What level of variation did you see in these good antibody titers? Was it homogeneous in the animal population, or did you see some animals with low levels of antibodies? And then the second question will be, can you explain that lack of transmission between animals that are so close to each other, of different age groups? I don't understand this.
Yeah, I don't necessarily understand it as well. I think it's just that, I think this impression that FMD, we think about free settings and we think about these explosive outbreaks, but I think in some settings we just don't see that. Like when you look in the field, you don't always see that, and that's why I think it's context specific, which is why field data is so important for understanding the disease, I think, in transmission. But in terms of the variability in titers, I mean, this is, yes, occasionally there was an animal that wasn't a very good responder to the vaccine, but of course, these are the confidence intervals here, so that takes into account that variation. Yeah.
Yeah, David, please. Okay. Chris?
Yeah, if you don't mind, Nick, I mean, back to that situation where these young stock the infection was not transmitted, you say. But did you apply any serology there? I mean, that would be interesting to...
Did what, sorry?
Well, did you apply serology in the young stock?
No.
On the other side, because you say there's no transmission, but you can't substantiate that without taking some samples, isn't it?
That is true, but I personally think that if you've got, bear in mind, these animals are all related. It's not like these animals have been purchased from somewhere else that might have been exposed. So, logically, if you've got the animals that have received lots of doses of vaccine and they're affected, you would expect that if there was exposure in here, you would see some cases because they're receiving the same vaccine. So if you don't see any cases, you kind of logically think, well, they probably weren't exposed. I mean, the thing is, these groups here, these are 70 to 120 days, and we've seen in other studies that the clinical signs among young animals, like really young animals, I've seen it in Kenya, and there's been reports even from the Netherlands in the 2001 outbreak, which the UK gave to you. We've seen that the disease can be very mild. So these animals could have had disease, but they weren't examined sufficiently, maybe. I don't know. But these animals here, I mean, I think that the chances, it's very unlikely, I believe, that these animals were exposed. I believe so. Yeah, that's also, yes, okay, fair enough. But yeah, but of course, don't forget there's the maternal antibodies going on here as well. So actually, this farm here, this farm has outbreaks almost every year. So I think NSP antibody titers will be very difficult to interpret.
Okay. Okay, maybe a quick question, last one.
Yeah, just a point, actually, Nick. It's having been to those farms, it's my understanding that the cattle are sort of root sprayed 24/7 with water sort of pumped out from the wells. Is that correct?
Yeah, because of the heat. Yeah.
So my feeling is that the lack of transmission between pens or rows, it could be that you're not getting the aerosol transmission because of the water washing away the animals' lesions and things, and you don't get the opportunity for spread because of the actual flow of water across the animals. Is that a possibility, do you think?
I'm not sure actually that young stock have the same sort of spraying going on. Actually, I think it tends to be the adults because, of course, the heat affects fertility and affects dry matter intake and that sort of thing, and that's more of an issue for the older animals. So I actually think I'd have to check with the farm, but I think the spraying actually is more for the adults, not for the young stock. So whether that's an issue, I don't know. But
okay. Many thanks. So now we need to pass to the next presentation. That will be